Hi, my name is Gena Golden, and I'm here to talk about the coronavirus. Now, the official name is COVID-19. So, I'm going to talk about 5 facts about COVID-19. Okay, and I'm going to refer to my notes. Number one, this disease can make anyone sick regardless of their race or ethnicity. Fact number two, the risk of getting COVID 19 in the United States is currently low. Fact number three, someone who has completed a quarantine or who has been released from isolation does not pose a risk of infection to other people. Fact number four, you can stop the coronavirus or COVID 19 by knowing the signs and the symptoms. And fact number five, there are simple things you can do to help yourself and others stay healthy. So, let me just explain that the CDC has outlined very specific travel precautions for the regions most affected at this time. So, if you traveled or have been in close contact with someone who traveled, including on a cruise ship, to countries like China, Iran, South Korea, Italy, Japan, and Hong Kong in the last 14 days and are exhibiting mild to severe symptoms of fever, cough, shortness of breath, then you should call your medical professional immediately. Okay. The CDC urges that if you are sick with symptoms including fever, cough, and difficulty breathing, keep away from others who are sick and limit close contact with others as much as possible. You should restrict your activities outside your home except for medical care. Do not go to work, do not go to school, or attend non medical appointments. Avoid public areas, including public transportation, ride sharing, or taxis. Now, again, this is only if you are exhibiting the flu like symptoms. Okay? So remind everyone, these are very simple things that you can do. If we all do this, then we'll be in better shape. So go ahead and remind everyone in your household of the importance of practicing everyday prevention. And these can help prevent the spread of respiratory illness. The first thing is to cover your mouth, cover your cough when you sneeze. Cover your cough and cover your sneeze with a tissue or with the inside of your elbow if you don't have a tissue. But don't forget to wash your hands after you sneeze. Wash your hands with soap and water for at least 20 seconds. Now, oftentimes, the way to know if it's 20 seconds, you can count to 20, or you can sing the happy birthday song twice. But wash your hands, especially after going to the bathroom, definitely before you eat, and after you blow your nose, cough, or sneeze. Now, keep in mind that if soap and water are not available, use hand sanitizer, but check out the ingredients. Make sure it's at least 60% alcohol. And just avoid at all costs rubbing and touching your eyes, your nose, and your mouth with unwashed hands. So once again, those are some of the general precautions you can use to help to eliminate the spread of the coronavirus, which the official name is COVID-19. So I hope that this is helpful to you and your family and loved ones. If you need mental health services, if you're having a hard time coping, if you are experiencing increased anxiety, fear, worry, a sense of hopelessness, depression, whatever it is surrounding the coronavirus, reach out to a mental health professional as soon as possible. Now, if you are exhibiting some of the symptoms of the coronavirus, then you can still call a mental health professional after you've called your medical professional. Many mental health professionals are doing what is now called telehealth counseling, where they can meet with you online and do a video exchange as we're doing now, and still provide you with the mental health services that you need.